Hi, I'm Dr. Craig Chappell at In2it Medical, and I've been asked to explain the differences in the regenerative medicine processes that we use here at In2it Medical. So I'd like to first start with prolotherapy. So if you haven't heard of what prolotherapy is the injection of an irritating solution into a connective tissue, usually tendon or ligament, in order to stimulate the body's natural response to heal. In our case, or in my case, I use dextrose as an irritative solution. Most people say, well, isn't that just sugar? Yes, it is. It's not the sugar that has a healing property, it's the concentration in which we use it. So normally in a hospital, we would give 5% dextrose through an IV to keep people hydrated. In my case, we use a solution of dextrose between 12 and 25%, depending on the structure that we're treating, depending on our needs as far as healing is concerned. With ultrasound guidance, very precisely put the medication in the affected ligament or tendon, which creates a perceived trauma secondary to the concentrational difference between the dextrose and your body. This kind of pops the cells open, at which time an injury is sensed by your body without any destabilization of tissue, and then a reparative process ensues. And that's, in a nutshell, how prolotherapy works. A step up from prolotherapy would be platelet rich plasma injections. In this case, if you can imagine prolotherapy as starting a fire in your tissue and you healing it, PRP would be adding a little gasoline to that fire to make it bigger quicker. PRP consists of a blood draw followed by centrifuging the blood, which separates the blood into layers. In our case, we want the platelet layer, so we harvest those platelets off that blood sample and then re-inject them back into the tissue, whatever tissue we're injecting. Generally speaking, ligaments, tendons, or muscles, so connective tissue. Also works very well. It's a little bit more potent, or it appears to be more potent than prolotherapy, so we have to do it less often. One thing I forgot to mention about prolotherapy is my average number of treatments is 3 to 6 times. I separate those by about 3 weeks. So every 3 weeks we repeat that process until we get where we want to be. With PRP, 2 to 3 times is generally sufficient for most pathology or most connective tissue problems. The next step would be something called stem cells. In my case, I use stem cells from bone marrow, so it would be your bone marrow. There's a lot of controversy concerning where the best place to get bone marrow is, and that was kind of resolved with the FDA statement on where we can and cannot get stem cells from. And today, we can basically get stem cells from bone marrow. There are other sources of stem cells, but have been discouraged by the FDA. So I follow their guidelines in producing stem cell. In this case, we use a bone marrow aspiration. So we insert a needle or a trocar into your hip. In this case, we usually do it under local anesthetic, but can use sedation if required or desired. And we harvest bone marrow. The bone marrow is then processed by centrifuging, and we end up with a concentrated adult mesenchymal stem cell solution. There are other components to this solution, including platelets, a few red blood cells, and even white blood cells, and plasma, but we do have an elevated concentration of stem cells to be re-injected. Stem cells are a little bit different than platelets in the fact that they are not as inflammatory, so they hurt a little less to have injected. And if you imagine like the fire analogy that I used a minute ago, in this case, instead of injecting fire and some gas, we inject the fire, the firemen, and everything responsible for healing into this one area, which speeds up the process. So the average number of treatments goes down a little, and my average number of treatments is 1 to 2, depending on the pathology that we're treating. My hope is that this conversation will help you to know which treatment option may be best for you. As far as what we treat, a lot of osteoarthritis, a lot of tendinosis. I would use the term tendinitis, but it's not an acute reaction. It's that chronic pain associated with ligaments and tendons that just doesn't get better with conservative care. That's what we're generally treating. We treat a lot of instability, a lot of athletes, and a lot of weekend warriors. So if you have any other questions, please give us a call and I'd be happy to help. Thanks.